Naruvi Hospitals, promoted by the Sanko Foundation, is the brainchild of the founder-chairman Dr. G.V. Sampath. Belonging to Vellore, the medical hub of India, Dr. Sampath's vision to create a medical destination for the people of Vellore in particular and others from India at large and also overseas resulted in the establishment of a hospital here, a real crown jewel in the field of healthcare. Large numbers of people belonging to Vellore and the surrounding districts have been known to travel to Chennai and Bengaluru, both nearly 200 kilometers away from Vellore, seeking medical care due to the dearth of facilities and the hardships faced by the locals to access available services. As per the vision of the chairman, the best in healthcare, both in terms of medical and nursing professionals as well as sophistication, were infused into the institution, making sure that patient affordability was addressed at all times. Less than a month after Naruvi Hospitals opened its doors to the public, the second wave of COVID loomed large as life. We took on the challenge and quickly rose to the occasion, catering to the local population and some from outstation as well, adding close to 40 critical care beds and over 200 ward beds to the COVID care pool. Much as it was hard for a 1-month-old hospital to handle such large volumes of very sick patients, Naruvi Hospitals was able to contribute significantly in our country's efforts to save people from the disastrous end that COVID was driving people to. Naruvi Hospitals is positioned as a high-end tertiary care center. Our focus on ethics, transparency, patient satisfaction, and an academic outlook in everything we do ensures that doctors, nurses, and others in the care team are performing at their conscientious best to not only treat patients' ailments but also to make them happy overall when they leave our hospital. We have tied up with the Henry Ford Health System, HFHS, based out of Michigan State in the United States of America. HFHS is one of the old and leading healthcare delivery systems in Midwestern America. The main aim of this tie-up is to have constant transfer of knowledge and to get access to the time-tested practices they have been following for decades, which ultimately translated to patient care. Naruvi Hospitals is a completely paperless and filmless hospital. The Naruvi philosophy of care is embodied by our motto, Fragrance of Care. The doctors in Naruvi are largely trained in the best of medical institutes in India and come with years of rich experience in their fields of expertise. With the philosophy and its pallbearers, the medical and nursing professionals, the high-end equipment, and the building infrastructure complete the holistic picture of Fragrance of Care. The hospital is 475 bedded with a 25% critical care bed count. Naruvi Hospitals boasts of an over 5 lakh square foot building spanning 14 levels. The building is completely air-conditioned, conforming to ASHRAE standards with zone-specific air conditioning to reduce cross-infection between different care areas. Our laundry is 100% barrier washed. We have a top-of-the-line sterilization department with machines with 95% water-saving machines, saving up to 300 liters of water every running hour. We have all the major medical and surgical specialties. There are 16 modular operation theaters with laminar airflow. All the equipment in the ICUs and OTs are pendant mount to avoid clutter on the floor. All the departments are equipped to the most modern standards with the best and latest equipment so as to be able to provide the best end-to-end treatment to our patients. State-of-the-art cardiac cath labs, the latest robotic hybrid OT, ECMO, interventional pulmonology, high-end orthopedics, general and bariatric surgery, epilepsy monitoring unit with robot-guided epilepsy surgery, neuro monitoring, navigation, the latest lithotripter, urology laser are just some of the arrows in our quiver. Our primary focus, though being the local Vellore people and Indians at large, we are working towards attracting overseas patients as well. We have started an office in North Sudan in Khartoum. We're in the process of tying up with the governments of Oman and Seychelles as well. In all, Naruvi Hospitals is more than a hospital. It is an experience. Naruvi Hospitals, promoted
We will get this webinar started right now. I request all the panelists to kindly turn on their cameras while we get this session started. So, firstly, a very good morning a very good evening to one and all present here. A famous quote goes that a smile is a curve that sets everything straight. And today's webinar is all about making you feel positive with your face and your smile because these doctors surely know how to do that. My name is Hibba Mariam, and it is my pleasure in welcoming you all to the webinar on dentofacial aesthetics, brought to you by Naruvi Hospital's Vellore under the Hindu Wellness Series. We have three amazing doctors who are here to guide us through this webinar. So, firstly, a warm welcome to Dr. Surya Prakash Sharma, Senior Consultant Prosthodontist, Oral Implantologist, and Head of Dental Medicine, Naruvi Hospitals Vellore. A warm welcome to you, sir. We also have Dr. Sarvapalli, Senior Consultant Orthodontist and Dentofacial Orthopedist, Naruvi Hospitals Vellore. Warm welcome to you as well, doctor. And lastly, the only lady on the panel, we have Dr. Harni Manoharan, Consultant Oral and Maxillofacial Surgeon. With that being said, let's get this webinar started. A request to the audience, if you have any questions, you can use our Q&A box to put up your questions, and at the end, we will have all our doctors answer them for you. So please make use of that opportunity. So, with that being said, our first speaker will be Dr. Surya Prakash Sharma. Dr. MDS is a prosthodontist and oral implantologist. He has a fellowship in oral implantology from the International Congress of Oral Implantology, USA. Dr. Surya is currently heading the dental department at Naruvi Hospitals, Vellore. He has more than 12 years of clinical experience after his post graduation. He practices both general dentistry and specialty practice in the field of prosthodontics like smile designing, full mouth rehabilitation, advanced dental implants procedures, and TMJ disorders management. He will now be addressing us on the topic dental restorative aesthetics. Over to you, doctor. Doctor, you're muted. Yes.
Thank you. Thank you for the introduction. So good evening, everyone. Thank you everyone for attending this webinar. Thank you the Hindu team for conducting this webinar. I'm Dr. Surya. My topic for today is dental restorative aesthetics. Restorative is nothing but it is dental fillings, dental crowns, dental veneers, and dental implants. So we are trying to achieve the aesthetics with the help of this dental restorations. So, for example, if you see this picture, the above picture is a pre-procedure picture, that is before treatment, and the down one is the after treatment picture. So from here to here, it involves a lot of steps and lot of principles. So aesthetics is not only about cosmetics. The aesthetic should be in that sense where it should be functional, it should preserve the structure of the teeth, and it should respect the biology also. So I would rather call it as a functional aesthetics. So from here to here, we follow some principles, and my principle is EFSB, that is aesthetic, function, structure, and biology. So in aesthetics, what do you see? Once the patient comes, so first thing we have to do is we have to gather the history, medical history, everything. Then once the aesthetic planning is done, we have to take a full face picture. And then what you have to see in aesthetics, the first thing you have to see is this tooth position. This is the most important point when you're planning for aesthetic smile designing or a full mouth rehabilitation. These two are called maxillary central incisor, and this position is very crucial in the treatment planning. So what we have to do is first we have to see the amount of exposure at a normal rest position, then amount of exposure at a slightly smile posture, and a full smile. So one by one we'll see. So we start with the first full face picture, because this eyes and everything should be expressed, because the complete smile without this eye is incomplete. Then we have to take a lateral picture. We have to see this teeth inclination. We have to see whether the patient is able to close the lip without any extra effort. How is the teeth inclination? Is it proclined? Is it retroclined? Or is it straight? We have to evaluate that. Third thing we have to see is amount of tooth exposure during rest position. So for male, it is approximately 2 mm, and for females, it is approximately 3 to 3.5 mm. Then we have to see the amount of teeth exposure during a full smile. We have to see the gum levels also. You have to see the gum levels. An ideal smile is a full exposure of teeth with 1 to 2 mm of gum exposure. If the gum exposure is above, say, 3 mm, it is considered to be anesthetics. Then later we see, as I told you, it is not only aesthetics, it is functional aesthetics. We have to see how is the occlusion, whether there is an anterior deep bite, whether there is a posterior deep bite, is there any malocclusion. We have to note down everything during the planning. Then you have to note for the wear and tear, whether the teeth has attrition, erosion, or abfraction, any wear and tear is there or not. We have to note down that. Then as I told you, it is EFSB. The aesthetics is already covered. Now function. You have to, before any smile designing or full mouth, you have to check the joints, because these are the most important point. If the joint is not correct, then this occlusion will be a problem. So you have to check the TMJ joints, whether their movement is okay, all the range of motion, whether there is any pain or not, and then associated any muscles, and is there any tenderness, is there any teeth wear. You have to check all this. Then coming to the structure. Structure, we have to see, yes, of course, we are planning for smile designing, but before that, we have to see whether in the oral cavity, is there any severely decayed tooth, if there is any infection, any abscess is there or not, or any oral lesions or ulcers. So you have to check all these points, note down. Then you have to respect the biology also. For example, if the gums are bleeding, then you cannot do a smile designing. First, you have to treat that. If there are any gum recession, if there is any bone loss. So collect all the datas. So while planning, we are planning aesthetic as the first, then function, then structure and biology. But while execution, first we have to treat the emergencies. Emergencies, like if the patient is having any dental abscess, you have to treat that first. If the patient is having decayed tooth, then you have to treat that first. If the patient is having gingivitis, you have to treat that first. Then for all the emergencies and necessary dental procedure, finish that first. Then you can go for the aesthetic planning. So, for example, in this case was done in 2015. She was a 19 or 20-year-old girl. Her first complaint was uh, aesthetic concern. So this condition is called amelogenesis imperfecta. In this, the enamel, which is the top layer of the tooth, it is not formed properly. It is not matured properly. When the enamel is formed properly and it is matured, it will be white in color and smooth in nature. But in this case, there is a discoloration, which is during the formation of enamel, there is a defect. So this condition is called amelogenesis imperfecta. And from this, we have done a full smile designing, and it is a full mouth rehab case. And this is her final smile after the restorations. And we have a 9-year follow-up. So this is the lateral view. You have to see as I told you, the occlusion and bite is very important. So from this to this, we have corrected the bite also. So this is the left lateral view. This is the right lateral view. This is an occlusal view with pretty decent crowns, clean. The patient is maintaining it well also. There is not much inflammation. This is the lower arch. This is second case. She is a 65-year-old and she came to me with a complaint of spacing in the tooth. Her son, he is in Singapore and she wants to travel within 2 weeks. And before that, she wants to close all the gap. I gave her the option of orthodontic treatment, but she was not willing for that. Then the second option I gave was the aesthetic veneer option. Veneers is nothing but it is a minimally invasive option for when compared to the crowns. So I gave her the veneer option to correct and close the space. Then we did the veneers, all the spaces were closed, and this is her improved smile. This case was also done in 2016. We have a good follow-up. She comes every year for a regular cleaning and scaling. And this is a third case. This patient is from Bangladesh. And she just came for a short visit to India. again, her complaint was the generalized spacing. Ideally, this case should be treated with orthodontics, but orthodontics was not feasible that time because she was traveling abroad. So we gave her again the veneer option, and this was the spaces, the generalized spacing was closed with the help of veneers. The next case is this is a decayed tooth and it is a rubber dam. Whenever we are doing a dental restoration or dental filling, complete isolation is very important. The saliva should not come to that area. It should be absolutely dry. That's why we are using this rubber dam. And a composite restoration was done. A restoration should be done in that way. It should be biomimetic. Biomimetic means it should be as close to the nature of the tooth. It should function like a natural tooth. It should behave like a natural tooth, and it also look like a natural tooth. So that's called biomimetic restoration. For example, in this case, these two teeth have a dental caries, and this filling was done by us. So this is almost close to the morphology. When the morphology is perfect, it will definitely function well, and the longevity of the fillings will be also very great. Again, this example, he is a plastic surgeon. He came to me with a midline space. I gave him the option of orthodontic treatment with the help of braces, but he was not willing for that. Then the second option I gave is a veneer option. He said no, he doesn't want any trimming in the tooth. He doesn't want any enamel loss or anything. The third option I gave was a simple composite restoration, and then it came out well. This was the composite restoration done in this tooth, and this was quite a good result. This is again a 20-year-old girl. She came in 2016 with all this pitted and rough enamel. Overall, the tooth structure was sound, but the outer layer of enamel was not formed properly. It was not properly matured. And again, it is treated with the help of veneers. Veneers is nothing but the difference between veneer and crown. Veneer, we prepare the tooth only on the front portion, and that also only 0.5 or 0.3 mm. So this is very minimally invasive option for a smile designing. So this is the upper tooth which is prepared just 0.3 mm, and down and also 0.5 mm. And this was the final smile. So this is a pretty good result, and we have to make sure that whenever the patient is biting, the contact should be equally on all the teeth. It shouldn't be like one tooth has a very high point and the other tooth are not touching at all, or few teeth are touching, few teeth are not touching. No, it should be equally distributed occlusal forces. So that's why we make sure all the contacts are equally distributed. That again influence the longevity of the restorations. So this patient, he was using tobacco and he was using tobacco powder for brushing the teeth. So all his top layer enamel is all worn off. This is all abrasions, and he want a minimally invasive option. Plus, the cost was a major factor. So instead of ceramic veneers, we went for an acrylic veneers. So this was his improved smile. So we did this acrylic veneers, and he's supposed to report after 6 months or 1 year for the final ceramic veneers. So this was a VIT girl studying in VIT. She had orthodontic treatment for 2 to 3 years. But after orthodontic treatment, this was a relapse case. All these upper teeth, they got relapsed and the crowding came back. I gave her the option of ortho, but she said she's not willing for again 2 to 3 years of orthodontic treatment. So she wanted any second option. I gave her the option of veneers, and this was from canine to canine. We did a veneers, and which was a decent result. He is our oral pathologist. We finished the orthodontic treatment, but after the orthodontic treatment, he said his smile is looking very dull. There is a discoloration, plus the overall shade of the teeth. He was not very satisfied. Then we gave him the option of this veneer option. So few here and there is a midline space we corrected. The color we have corrected, and the overall arch form and the smile arch we have corrected. So this was done with the ceramic veneers. So generally, we prefer all the veneers and crowns with ceramic because it has longevity when compared to composite. But a few cases we have to do the full mouth rehabilitation cases with composite. He is a 75-year CMC gastroenterologist. He came with generalized abrasion and generalized attrition. You can see all the wear and tear. I gave him the option of full mouth rehab, but he was not willing for that. He said he wants some minimally invasive option. We did a full smile designing planning according to the EFSB protocol. We did all this diagnostic model, Facebook transfer, everything. We did the diagnostic waxer, and this you can see this fillings. So the full mouth rehab was done with composite. So these were the steps. We did the transparent silicone index and it was transferred to the patient mouth, and this was the end result. After the end result, it is very important to give a canine guidance occlusion, which will protect the posterior teeth in the eccentric motions. And this is the left lateral and right lateral occlusion. This is one more patient came with a missing tooth. All the other teeth were reasonably okay, but because of this missing tooth, his smile was affecting. And this was replaced with the help of an implant retained crown, which is almost looking like a natural teeth. So it is unidentifiable. So the aesthetic restoration should be in such a way that the patient the layman should not be able to identify it as a restoration, should mimic the natural teeth. This patient, she came with a missing tooth problem, but her bone was very, very less. So first what we did was we expand the ridge bone and then we placed the implant, and immediately on the same day we gave her the temporary restoration. This temporary restoration was designed in such a way that we gave a concave surface to accommodate the gums, to increase the gum thickness. And this was the immediate, on the same day we gave her the teeth. So from this to this on the same day. So this is also a biomimetic temporary restoration. Again, one more patient, very narrow, very tight space. She was missing this lateral incisor. And we did a diagnostic impression, diagnostic model. We did a stent. Then we planned for an implant. And then after 4 months of healing, we gave her directly the crown. So this was the replaced tooth. It is on the color, shade, everything is matched with the adjacent teeth. Even the occlusion is fine. This was the implant placed in the lateral incisor space. So generally, when we place the implant, the healing will be like this. But the problem with this conventional healing is there is a space in the interdental region, and these spaces cause foot impaction. So to avoid that, what we are doing is first we give a properly designed temporary restoration, which is a provisional crown. We create the profile for the gums. We that is called emergence profile, and then we fix the emergence profile on the implant, let it heal. Then we go ahead and give the permanent crown. So the advantage is you can see in this section there is a beautiful emergence profile which is created with the help of this provisional restoration, and there is no space in the interdental region. So this will again avoid foot impaction. It looks beautiful, but also it functions beautiful, and the structure also will be preserved. There won't be any much bone loss, and the biology is also respected. This patient came, she came with an old dislodged crown, and we removed this old crown and it was replaced with a new crown. So you can see these two, this is the natural teeth and this is the artificial crown, but they both are looking natural. They both are mimicking each other. So in this process, this shade selection process is very important. We are using this 18% gray card, black and white, in which we properly select the shade, and this shades should be transferred to the lab technician as it is. So the information transfer is also very important. What information you're giving to the technician, he will deliver according to that. So not only teeth, we are doing oral maxillofacial processes also. So this patient came with a decompressive craniotomy. So he was missing the whole part of this bone. And so we took impression of the bone. We made a prosthesis. It was fixed with the help of neurosurgeons, surgical method. And This will not only affect the aesthetics, but it will also improve the function of the brain. So this is the post-op of the prosthesis. So thank you everyone for patient listening. Thank you.
Thank you very much, Doctor, for sharing your thoughts on that. We're sure it gave good insights to the audience who have tuned in today. Once again, if the audience has any questions, you can put them up in the Q&A box, and towards the end, we'll have our doctors answer all of those questions. So with that being said, our next speaker will be Dr. Sarvapalli. Dr. Sarvapalli, MDS, is an orthodontist and dentofacial orthopedist. He graduated from the prestigious Meenakshi Ammal Dental College, Madurai, and was awarded the gold medal for his outstanding performance. He's also an Invisalign board certified and lingual board certified orthodontist. He's currently the top Invisalign provider in Vellore. His specialty is creating complex and early orthodontic cases. He is very keen on growth modulation, myofunctional, and interceptive growth orthodontics, and he will now be addressing us on the topic aesthetics in orthodontics. So, welcome, Doctor. The stage is all yours.
Am I audible?
Yes, yes.
Yes, well and clear.
Thank you. Thank you, Hiba, for the warm introduction. Good evening, all. Glad to have got this opportunity. Today, let's understand about dentofacial aesthetics. So let me break down dentofacial aesthetics for you. In simple terms, it means study of your face and your teeth. For an orthodontist perspective, both facial profile and teeth both go in hand to achieve aesthetic results. So dentofacial aesthetics can be analyzed at three levels, that is macro aesthetics, micro aesthetics, and mini aesthetics. Macro aesthetics involves the assessment of the face as a whole, where micro aesthetic involves teeth with one another, and mini aesthetics refers to the amount of teeth and gums visible during your smile. Let's dig deeper into macro aesthetics and how do we achieve it. We have already discussed that macroaesthetic deals with overall facial structure of the face and its relation to the smile. Let us see a few ways in which we can analyze macroaesthetics, which includes facial profile, facial proportion, symmetry, and midline. So facial profile is nothing but the side view of the face, and the ideal profile should form a straight line connecting the forehead, the base of the nose, and the chin. So when you draw a straight line connecting all these three and you form a straight line, that is a straight profile. So the other two pictures you can see, one indicates both indicates there is a deficient jaw either in the maxilla, that is your upper jaw, or the lower jaw, either of which, if it is there, you will have a convex or a concave profile. We would have witnessed a lot of models showing the side profile many times as it is the most attractive angle. Facial proportions. So the proportions of face can be analyzed in frontal as well as in lateral. An ideally proportioned face can be divided into equal fives. That is, 1/5 of the face can be divided into equal fives, whereas the lateral can be divided into equal thirds. So let's talk little about facial symmetry in this photographic method. So this is a photograph. The center photograph is the original photograph. The image on the left is using the two right sides of the face, and the image on the right to me is two left sides of the face. So if you take a closer look of the image, two right sides of the image gives you a resemblance closer to the original, whereas the two images on the left gives you a completely different person appearance. So from this, what you can understand is that most of us will have asymmetry, just that it is not very evident. If the level of asymmetry is very high, then it has to be addressed along with other mathematical equations. Facial midline. So midline is the line that connects the soft tissue mesion, that is nothing but the juncture of your two eyebrows. This point is known as nasion, and to the base of the nose and to the chin. tip of the nose to the chin. So if you connect all these lines, there will be a straight line. So that reveals your facial midline. In smile designing generally itself, the start point of aesthetic treatment plan is the facial midline. Having a straight facial midline is an ideal scenario for macro level aesthetics. So we have discussed macro aesthetics out of the 3 levels of facial aesthetics. Let us now move on to micro aesthetics. So micro aesthetics involves the alignment of teeth to one another with the jaws, and it also describes the color, form, size, and proportion. For vast majority of patients, the primary goal of orthodontic treatment has to improve both dental as well as facial aesthetics. Let's discuss some key factors determining micro aesthetics. Tooth proportion. Tooth proportion is the width of the single tooth in relation to one another. An ideal width of a visible teeth should be 80% of its height. So 80% of your height should be a visible amount of teeth which should be seen during smile or whatever it is, speech or any other activities, 80% should be seen. Connectors. Connectors are interdental contact area between two teeth. That is, this region is your connector, and this triangular space, can you see? That's an embrasure. Embrasures are seen between the two teeth. The shape, the color, and the gums of our teeth are also important in microaesthetics because this describes how good our gums are. If they are bulgy or little bit inflamed, they don't give you a good microaesthetic result. Mini aesthetics. So this includes the display of teeth during rest, smile, and during speech. So amount of incisor and gingival display. Gingival display is nothing but the amount of gums which is visible during your smile. Like Dr. Surya would have shown about transverse dimension of smile in multiple photographs where you would have seen patients viewing in that angle. The upper teeth should be seen visibly with some amount of your gums when they are smiling. And when we describe smile arc, this is a beautiful picture which tells us what is a smile arc. That is your canine, your central incisor. When you draw a small line connecting all these things, there will be an arc which will be connecting. This is known as a smile arc. So this is very ideal to achieve a very good smile. Symmetry. So see, we just a few slides back we saw about facial midline, right? So that facial midline and this dental midline. Dental midline is nothing but the midline between the two upper central incisors to the upper lip, a line drawn, imaginary line. This midline and the facial midline, when both joins together, gives you the best of the best results. So now we have understood 3 levels of facial aesthetics. We look into the treatment options available to achieve micro, macro, and aesthetics in how we change the intervention. Age. Age is something which is very important in correction of macro level aesthetics. The earlier the age, the better it is. So you would have seen Surya showing lot of cases where all those cases who are above a certain age, where they are adults, completely adults above 18 years, where it definitely growth has been completely ceased, where we cannot actually correct the macro level aesthetics. All those, whatever Dr. Surya spoke about, is everything about micro level aesthetics, that is only teeth. Macro is the facial form of your structure. That's how your structure of your face is. That can be corrected with orthopedics, not orthodontics, orthopedics. It's a first phase of your treatment before orthodontic treatment. Intervention during this phase will eliminate the cost for surgery. My colleague Dr. Harni will be elaborating on more on the surgical options of how we can correct using surgical procedures. Let's look at the possible conditions that require orthopedic. That's what orthopedic is: facial form and facial structure, which we talked about, macro aesthetics, that we can correct in the growth phase. So maxilla means, in simple terms, it is the upper jaw, and mandible means this is the lower jaw. Problems that can encounter are mostly it might be excessive upper or lower jaw, or reduced or recessive lower or upper or lower jaw. We shall see certain examples so that it will make you better understanding of what and how we can actually help in correcting these scenarios for a betterment of the child. So we are looking in this case of excessive upper jaw growth. So this is the before picture, this is the after picture. So let's say the patient has a vertical maxillary excess. So he has come to you at the age of around 10 years. So even then, there is the maxillary growth, that is your upper jaw, there is some amount of growth which is left. So using this as an advantage, major advantage, we can actually stop or correct the growth of the underlying this thing. So this has been corrected using a maxillary headgear in which we have stopped the upper growth as well as tried to push in using a maxillary intrusion splint. With the help of this, you can see a profile, which is a profile is what we talked about is this soft tissue on upper point, lower border of the nose and the chin. You can see connecting all these three dots, it's a convex profile. Now look at this post picture after treatment. You can see that the profile is really straight and it looks very, very neat for the patient to presentable, very, very presentable. So this is exactly why intervention during growth phase is crucial to achieve macro aesthetics. Now let's look into another scenario of recessive jaw. So what is recessive jaw? So recessive jaw is nothing but when your upper jaw growth is stuck or it's not grown fully and your lower jaw is ahead. So to correct this kind of scenarios, the earlier the better. So say instance you are around 8 years to 11 years of age, it is very, very important that if you notice your kid or anyone who is on this age, please recommend them to go to an orthodontist to enhance their profile treatment first. Because what is that is this growth is shunted and this growth is more. This lower jaw growth is more. When you correct using this kind of appliance, that is a face mask. So this is nothing but is externally worn on the patient's face where it tries to pull your jaw outside. When this is worn, what has happened is you can see this side. This is a concave profile. You can see this profile is going like this, joining all those 3 points. It's going in this angle. If in this, you can see it's in a straight line. So this causes a major change to the patient. This is a phase 1 therapy, and phase 2 therapy will be using braces or aligners. The treatments are usually a combination of both orthopedic as well as orthodontic. They both go hand in hand. Like I already mentioned, these results are achieved only by changing the direction of the growth because growth can never be stopped. If we miss the intervention during this phase, only surgical options are available. So coming to micro aesthetics, as we discussed already, micro aesthetics involves the alignment of teeth on the arches as well as color, form, size, and proportion of the teeth. The common problems faced using micro level aesthetics are Dr. Surya would have shown you certain images of patients having spacing, crowding, and all those things. All those scenarios, like spacing is a scenario in which there is excessive gap in between your teeth. Crowding is where there is not enough space between your teeth and your teeth are overlapping against each other. And open bite is a condition where the space between the upper and the lower teeth, even after fully biting, was not able to achieve seal. So scenarios like these can be corrected using orthodontic procedures. So to achieve micro level aesthetics, braces or aligners come into the picture. Braces or aligners are used to correct the problems such as excessive spacing, crowding, deep bite, open bite, cross bite, scissors bite. All scenarios can be corrected using these kind of fixed functional appliances, fixed orthodontic appliances. So the braces are commonly of three types. They are traditional braces, that is your metal braces, ceramic or clear braces, and clear aligners or Invisalign. So metal braces are the most commonly used type of braces. Advancements in today's technology have made sure that today's braces are smaller, comfortable to the patient, and is more efficient. So this, if you can see, this is a self-ligating braces where it has got a door. This is your traditional braces where this has got an elastic to hold the wire. The difference between these both is that the later one, that's the conventional braces, gives you a lot of friction, so the treatment time is prolonged. Whereas self-ligating braces allows the user for fewer appointments, lesser friction, and less discomfort, with reducing the treatment time to half. Moving on to ceramic braces. These are made from discrete materials. Ceramic braces are less noticeable and less noticeable than traditional braces as they blend close to your teeth color. Ceramic braces offer the same advantage as the metal braces and are a good option for patients desiring a less and a visible appliance. Typically, older teens and adults prefer these kind of appliances. So this is the latest in technology. This is Invisalign. So Invisalign consists of a series of custom-made thermoplastic aligners. So for a patient, you get lot of trays for each patient. This is the most patients are using this kind of appliances nowadays because it's hardly visible and there is no metal or wires involved in this appliance. This is less discomfort. There is no food restriction, unlike traditional braces. It is more convenient and does not involve monthly doctor visits, unlike your metal or your ceramic braces. Many cases which traditionally could be treated with braces can now be treated just as effectively as using Invisalign. So to conclude, for optimum facial aesthetics, achieving ideal macro, micro, and mini aesthetics plays a vital role. An interdisciplinary approach is usually helpful. Every factor should be determined. Only then we can achieve aesthetic face and smile. Thank you for the opportunity and thank you for your time.
Thank you very much, Doctor, for sharing your thoughts on this topic. I'm sure the audience will have a lot to grab from. So thank you very much for that. Once again, reminder to the audience, if you have any questions for the doctors, you can put them up in the Q&A box. And towards the end, we will have all of your questions answered. So that's with that. And now we have our final speaker, who is Dr. Harni Manoharan. Dr. Harni Manoharan, MDS, is an oral and maxillofacial surgeon, graduated from the renowned Ragas Dental College and Hospital in Chennai. She was named as the best outgoing student in her batch. Apart from her incredible academic knowledge, she has also completed her internship in oncology and trauma in Chennai. Her dedication towards her profession and care that she expresses towards her patient are different and one of a kind. She will now address us on the topic aesthetics by non-surgical and surgical methods. Over to you, Doctor.
Thank you, Hiba. And I would like to thank Dr. Sarvapalli for the opportunity. So yeah, today I'm going to talk about aesthetics by surgical and non-surgical methods. So what is beauty? So what is fairly standard is that the more symmetric one's face is, the more attractive the person appears. The face is a mirror of what we are from inside. So it is like an opera that reveals a person's inner self, nature, personality, and health. The signs and symptoms of age, illness, deficiencies, and personality traits show on our faces. So there are the components of face that clearly augment or detract from an overall image of beauty such as eyes, smile, jawline, skin tone, and textures. When these features appear youthful, combined with symmetry, we tend to recognize the individual as attractive. So aging is a process which cannot be deferred. With the process of passage of time, every individual goes through the phenomenon of complex transformation, which takes away the youthfulness. And this aging takes place in two different categories. So one is extrinsic aging and another one is intrinsic aging. So the combined effects of environmental factors under the control of patients, along with the habits such as smoking, lifestyle, geographic location, and a long exposure to sunlight. So the intrinsic aging is of a combined effect of physiologic and chronologic aging. That is, this takes place in a cellular and molecular level. So as the aging occurs, the skin of the faces, it loses the collagen and elastin due to the sun exposure, gravity, constant muscle contraction caused by talking, smiling, laughing, and other expressions. So the skin loses its elasticity, causing a deep wrinkles, jowl formation, and sagging skin in the neck. So facelift gives an excellent and instant cosmetic result and is not meant for women alone, but it is also meant for men. So what is a facelift? A facelift will tighten the jowls, cheeks, the skin of the neck, tighten the neck tissues and soften the smile lines. The primary goal of the facelift is to tighten the tissues which have started sagging due to age and gravity. So the benefits of the facelift include it instantly eliminates the fine lines, marionette lines, regenerates the skin, holds the skin tight in the previous position, and minimally invasive treatment technique. So I'm going to discuss this topic in two different categories. One is the non-invasive procedures and other is the invasive procedures. So the non-invasive procedures includes the fillers, threads and lasers, Botox, radio frequencies. And in invasive procedure, we're going to talk about the orthodontic surgery, either in a maxilla, that is your upper jaw, or in the mandible, your lower jaw, or both upper and lower jaw. So the non-invasive procedures include dermal fillers. So these are the gel-like substances that are injected to the skin to restore the lost volume of the face and to smooth out your wrinkles, soften the creases, or enhance the facial contours by filling up void or wrinkles. So the newer versions of this dermal fillers include hyaluronic acid fillers, injectable silicone, polymethyl methacrylate, calcium hydroxylapatite, polylactic acid, and autogenous fat injections. And the next coming is Botox. There is some difference between the dermal fillers and the Botox. The fillers will just complete your voice, but the Botox, it contains the putrefied bacteria that freezes the muscles. In doing so, the Botox can help minimize the appearance of the lines, wrinkles caused by the facial expressions. This works by blocking the nerve signals and the muscles where it is injected. When those nerve signals are interrupted, the affected muscle is temporarily paralyzed or frozen. So without the movement of these selected muscles in the face, certain wrinkles may be softened, reduced, or even removed. So the next is by radiofrequency facelift. This radiofrequency energy treatment is a non-invasive technique for tightening the early signs of loose or lagging skins. This cannot be treated with severe cases. So this heat energy will reactivate the collagen under the skin and will produce the newer cells so that the skin laxity will reduce. So it is commonly used to treat the forehead, under the eyes, cheeks, mid-face, jawlines, and neck. So the next is laser facelift. So nowadays the lasers are into everything. So the laser skin resurfacing works to give you clearer, younger looking facial skin by removing the skin layer by layer with precision. So this means you can rid facial skin of blotches, scars, wrinkles, or acne scars. So the next non-invasive method is of thread lift. So thread lifting modality, it utilizes a biocompatible implant that is placed deeper into the layer of your face and it realigns the tissues. So when compared with a surgical procedure, it elevates the drooping tissues with the least amount of risk and complications and immediate results and rapid recovery. So there are two major indications for this thread treatment include skin regeneration and elevating the sagging skin. So next comes the invasive procedures, where before we enter into the surgical procedures, we should know about the deformities of maxilla and mandible so as to step into the surgical procedures. So the maxillary deformities include maxillary prognathism. To show you an image so that it will be very easy. So maxillary prognathism, where you can see them forwardly placed upper jaw, and the maxillary retrognathism, where you can see the backwardly placed upper jaw. And in the transverse, we can see the deficiency in the anteroposterior direction. And some other external features which we can see is a short upper lip, like incisor exposure, concave face, and in the retrognathism, it is a concave profile and it's a convex profile. So some other features will show you either it is prognathic or retrognathic or transverse. And similarly in the mandible, you can see the defect that is forwardly placed mandible or the backwardly placed mandible, or even the deficiency in the transverse direction, that is in the anteroposterior direction. And similarly with the extraoral features, you can also see the lowered facial height, short upper lip, and you can see the concave profile and the convex profile in the retrognathism and the posteriorly placed chin. So these are some of the features which we can see the deformities. And the combined deformities with the skeletal anterior open bite, so the jaw will be open, patient cannot occlude. And in the skeletal deep bite, it is completely deep and the lower mandibular incisus is not shown. So how to treat? So before entering into the treatment plan, the patient concern and the chief complaint is the most important thing. Then comes the clinical evaluation, followed by the radiographic and the imaging analysis, followed by the dental model analysis. Then it is desired to do the surgical treatment. So there are certain maxillary surgeries and mandibular surgeries. There are several types in each to do the surgeries. So the maxillary surgeries include either the maxilla, that upper jaw is done in segment or in total, so that the desired result is achieved. So here are some of the images I can just show you. So this is a segmental cut of maxilla, that is the upper jaw, so as to bring forward or backward to get the desired position. So here are some of the other techniques like Lefort 1, 2, 3, where the cut of jaw is deferred. So if only the maxilla is cut, it is called Lefort 1. If it is cut along with the nasal bone, it is called Lefort 2. If it is cut along with the zygoma, along with the cranium, there is a craniofacial disjunction, it is called D4-3. This depends based on your deficiency. So next comes the mandibular surgeries. So similarly, either the mandible, based on the deficiency, it is brought forward or backward. It's brought forward or backward. So either the entire mandible can be brought in, or only your genium, that is your chin, can be brought either forward or backward, or it can be rotated so that the desired position of your surgery is achieved. So the non-surgical procedures offer a range of benefits, including the minimal downtime, reduced risk, and immediate results. However, the surgical procedures may be more suitable for those seeking the long-lasting changes. So the beauty is not only in the eyes of the beholder, but also in your surgeon's hand. Thank you.
Yeah, that last line summed up the whole thing. So thank you very much, Doctor, for sharing your thoughts. And it was a lovely presentation. We will now be taking questions from the audience, and if it's for a particular doctor, you can unmute yourself and give us the answer. So we have a few questions in our Q&A box. Our first question goes, tell us about the difference of ceramic veneers and acrylic veneers. I think Dr. Surya can take this question, I think, in your presentation. Yes, Doctor.
This acrylic veneers is more of a temporary option. It is just a plastic material, and the ceramic veneer is a more long-term option. Both are minimally invasive, but this ceramic veneer have more color stability. It has more strength when compared to acrylic, and it's a more of a long-term option. It will have a longevity of around 10 to 15 years. Whereas acrylic veneers will have a longevity of approximately 6 weeks to 6 months.
Thank you very much, Doctor, for sharing your thoughts on that. Our next question is again to Dr. Surya. It says, hi, Dr. Surya, sir. Can you please explain more about how to do shade selection using 18% gray card?
So this 18% gray card is available. First, what you have to do is you have to take the shade guide. There are different type of shade guides. I think this question is from a dentist. So you have to first select the chroma, what category the chroma comes. Then you have to come to the next option. And then you have to keep this 18% gray card and the particular tab. For example, if it is A1, A2 or A3, and then take a picture, and you have to take one black and white picture and one color picture. And then accordingly, you have to select the shade, and you have to transfer the same information to the lab technician with photographs.
Thank you very much. Thank you very much, Doctor, for sharing your thoughts on that question. Our next question goes, how long will it take for mandible to grow when the patient is under a maxillary gear? Anyone who wishes to answer can. Yes, Dr. Sarvapalli.
Repeat the question. I was not clear at the end.
Yeah. How long will it take for mandible to grow when the patient is under a maxillary gear?
See, that maxillary gear is something headgear we call it as. So headgear is actually to promote or to restrict the growth of the upper jaw. So basically, if the growth is in excess in the upper jaw, then we try to restrict using that appliance. For instance, that is why we take a cephalometrics. That's what we take a X-ray. It's a cephalometric X-ray, lateral X-ray, in which we find out what growth, which phase is it in. Based on which we will have to see whether which jaw is in deficiency, whether it is the maxilla or it is the mandible. If it is the maxilla, then we will have to use a reverse pull headgear. That is what a face mask is. If the growth of the jaw is in the opposite jaw, that is your jaw is growing forwardly in the lower jaw, then you'll have to restrict this jaw growth and promote the upper jaw growth. Or if your lower jaw is shunted, then we'll have to promote the lower jaw growth during the growth phase. So how long it will take? Say, instance, this is a phase 1 therapy, which we call it as. Most likely, this will take close to 8 months.
Thank you very much, Doctor, for giving us the answer to that question. Our next question goes, I'm 27 years old. My lower jaw is protruding about 1 centimeter from the upper jaw of teeth. And I have difficulties like slight pain and cracking sound when I open and close my mouth. What's the best procedure for treating this, and whom should I approach?
So as the group. Yes, sir.
Yes, Dr. Hari, please speak.
So the growth phase has been completed, right? So the surgical procedure will be best for the patient. So accordingly, checking with his radiographic and other extraoral pictures. So whether the mandible can be entirely taken back or only the genioplasty can be done.
Yes, thank you very much, doctor, for giving us the answer to that question. Our next question is, I think Dr. Sarvapalli can answer this question. What are the advantages of choosing Invisalign over traditional braces?
So traditional braces are slightly uncomfortable because you have to keep coming for every visit to the doctor to get it adjusted. Whereas Invisalign uses the latest technology in which it uses thermoplastic clear aligners, where you don't have to come multiple times. We give it at one shot, so you can keep changing every 10 days once. The results will be quicker and faster when compared to this. Food restrictions, if you take in traditional braces, if you break any one braces also, you'll have to come for an appointment to refix it, redone it, and then only the process keeps going. So your treatment plan would be interrupted in braces, regular basis. Whereas in Invisalign, it is a faster outcome where the treatment progress because there's no breakage of anything. So it keeps progressing faster.
Thank you very much, doctor, for giving us that answer. Our next question is, if lower anteriors are severely attrition, how to give crowns or veneers? Yes, anyone who would wish to answer can take up the question.
Yeah, you have to check the overall occlusion. You have to see why only the lower anteriors are treated. If it is attrition, definitely it is upper and lower together. That is called attrition. So definitely the upper palatal surface or the upper incisal surface would have been treated. So definitely you have to make a complete treatment plan, take a Facebook transfer, and you have to record the bite in centric relation, not in MIP. Then you have to evaluate in which direction the attrition is coming, whether the lower anterior attrition, the upper are matching, or whether the attrition is only in the centric or in the eccentric motion. Then accordingly, you have to plan your restorations.
Thank you very much, doctor, for answering that question. Our next question goes, do children need dentofacial aesthetics? If so, what type of aesthetics can be done?
So
Yes, doctor.
interfacial aesthetics is required. Like I said, profile. If there is any, since it's children, if there is any change in the profile where there is a lacking in your maxilla, that is your upper jaw is restricted or your lower jaw has grown too much. When you take to a dentist or an orthodontist, so when visualizing during phase, that can be corrected at that right time, even before if it is ceasing. So once your growth is ceased, we cannot correct it. To answer that question, yes, we need to show it them from 8 years of age so that if there are any defects in the jaw growth, it can be addressed earlier rather than going for a surgical outcome later.
Thank you very much, doctor, for answering that question. Next question, I think Dr. Hadni can take this question. It goes, how long does Botox and fillers last?
Yeah, actually, the fillers actually will complete only the voids, but can you hear me?
Yes, ma'am.
But the Botox will freeze your skin, so it will usually be there for at least 6 to 1 year of time. Then it will automatically metabolize in your skin. So then you have to do the treatment.
Thank you very much, doctor, for answering that question. Our next question is, how successful is a teeth whitening procedure? Which doctor would like to answer the question?
Teeth whitening is successful, but again, it is a temporary solution. We use some chemicals like hydrogen peroxide, sodium perborate, and all to bleach the teeth. So that will reduce, for example, if your teeth shade is in A3.5 or A4, we can bring it up to 3 shades down, like A2, we can bring it. But that is for a particular period of time. Again, once you start using, once you start eating and using regular this thing, the oral hygiene is not maintained. And then again, there is a chance that you may go back to A3 or A3.5. So teeth bleaching and teeth whitening is not a permanent solution.
Thank you very much, doctor. We have our next question. I'm not sure if I'm pronouncing the word right, but then correct me if I'm wrong. It goes, can MARPE be used for adults at the age above 25 years? MARPE. Whoever wishes to answer can give us the answer to that question.
Up is a maxillary expansion with assisted with mini screws. So we can use it based upon what kind of treatment we are going to do for the patient. So if the maxilla is extremely constricted where the patient has got a nasal blockage or something like that, yes. But reveal is so since it's more than 25 years of age, then we'll have to see an occlusal radiograph to know whether the union of the bone is good, based on which whether amount buccal bone, that is, this is from a dentist question from a dentist, I guess. So the amount of buccal bone expansion, whether it can give you an adequate result or not, will be based upon your occlusal or a CBCT X-ray to know better.
Thank you very much, doctor, for answering that question. We have our next question. It goes, can general dentists practice Botox and fillers in perioral indications?
No, actually, they have to do some cosmetology procedure or oral and maxillofacial surgeon can do the procedure well, because this will work under your skin and the Botox will analyze your skin and muscle. So this need a practice. Not everyone can do this.
With that being said, we have two more questions. We'll finish both of them. Our next question goes, for dental fluorosis, can we do composites or veneers in anterior teeth?
You have to see the dental fluorosis extent. If it is only few dots, like few pits, which is a few pits with the discoloration, definitely only those area you can do with the direct composite, and it will be an excellent result. If it is generalized, if it is involving more than 50% of the teeth, lot of pits are there, lot of brownish spots are there, a lot of white opaque spots are there, and it is covering more than 50 or 75%, 80% of the teeth, then definitely you have to go for a full coverage restoration for more aesthetic option.
Mm. And with that, we have our last question. It goes, does Botox cause facial paralysis?
It does not cause the facial paralysis. It causes the same for a transient period of time so that it will tighten the tissues so the patient will look younger. It does not cause any other thing. It will just stop the neurotransmitters so the skin will stop getting laxity, so it will stay there in the place. And it is also goes back to the normal position after a period of time. So again, we have to do some other procedures to stop the laxity.
Right. I think we just have one last question someone put up just now. If veneers chipped or discolored over a time, what would be the treatment plan, or can we go with veneering again?
You have to carefully remove the veneer and see the remaining tooth structure. If the tooth structure is not affected, if it is not broken, if it is not decayed, if it is still savable, then you can go for again the veneer option. Sometimes what happen after removing the veneer, sometimes the tooth stump, that is the abutment, will break. Then you might have to go for other procedures like post and core and full crown or an extraction and implant. So it really depends on the extent of the tooth structure. If it is well and good, then you can go for again a veneer procedure.
Right. So with that being said, we've now successfully come to the end of this really amazing webinar. Thank you all to the speakers, to doctors who have tuned in today to teach all of us a lot of new things. And thanks to the audience who has come in today on this Sunday evening to get knowledge on dentofacial aesthetics. This was the webinar on dentofacial aesthetics brought to you by Naruvi Hospitals Vellore under the Hindu Wellness Series. My name is Hiba and it was great moderating this session. Thank you all so much and do take care of yourselves.
Thank you very much. God bless
Thank
you.
you to everyone. Thank you.